Welcome, I'm Dr. Matt Everett from iHeal. I'm here today to cover some of the basics of our testosterone therapy program. There are a lot of places out there today that are doing low testosterone therapy, but not a lot of places that are doing it well. Our goal is to provide a comprehensive, personalized solution, and today we're going to cover some of the basics of exactly what that looks like for you. Number one, as we enter into testosterone therapy discussions, you have to understand not all testosterone is created equally. Our bioidentical testosterones come in three different forms: propionate, cypionate, and enanthate. Propionate is a fast-acting, rapid-onset testosterone that allows you to get the most benefit right away. Cypionate is a mid-acting testosterone. It's one that typically has a half-life of approximately 3 days, allowing you to maintain those benefits. And finally, enanthate is a long-acting or a long esterified testosterone that will allow you to continue to have energy, clarity of thought, and that general sense of well-being well into the week of therapy so that you don't spike and drop. So, as we go over the package contents today, let's take a basic look at what you should expect to receive when your package arrives. Number one is your vial of testosterone. Historically, we use a testosterone blend, which, as I mentioned, is a mixture of all three types of testosterone because that is the optimal therapy. You will receive 10 mLs. That typically comes in two 5 ml vials. mL refers to milliliter. That's a unit of volume. And so together, you'll have 10 mLs of testosterone that should last you approximately 10 weeks. Number two, you will receive either HCG or gonadoline. This is imperative. As you use testosterone, there will be an effect on your own production of testosterone that could result in you producing less than before you started the program. So by virtue of using HCG or gonadoline, we maintain your own production. This is essential so that you are always making as much as possible based on your own body's abilities. Now, HCG, as you may or may not know, stimulates the testicles directly to continue production and maintain fullness. Gonadoline works at the upper level through the hypothalamic pituitary axis to stimulate the release of LH and FSH, which subsequently go down to stimulate the testicles to continue their production of testosterone. For our purposes, you may receive one or the other. We typically are now using more gonadoline than HCG so that availability is consistent. As you know, testosterone therapy programs are constantly evolving, constantly looking for the best, most optimal therapy programs. And while HCG is available, it is not widely available, and so we are trying to pick a program that is consistent, effective, and without interruption. The third item that you're going to receive in medications is anastrozole. Anastrozole is a medication that prevents the conversion of testosterone into estrogen. This is essential. Certain individuals are going to take testosterone and rapidly convert it into estrogens. That's not ideal. You will quickly catch a case of the feels if you're not careful. So we make sure that we support you in that by keeping that enzyme activity controlled. You will take approximately 1/2 to 1 tab of this per week, which will allow you to contain your testosterone levels while keeping estrogen, but at levels that are acceptable for men. Now, those are the basic medications. Now we have the supplies. And as we look at this, you have to understand testosterone comes as an oil. And so you have to draw it out of the vial, and to do that, you have to use a syringe with a needle. You're going to need a larger needle though, because oil-based materials are harder to pull through, and so a smaller needle will not work. But it is important, it's almost imperative that you understand the needle you draw with will not be the same needle that you inject with. You will have to switch it. It will go from either a 20 or a 21 gauge, which is a large bore needle that you use to draw it, to a 25 gauge needle, which is what you will use to push it. Secondary to that, when you receive your gonadoline, or your HCG, it will need to be reconstituted. What that means is these come as powders that are heat stable, they're preserved, and you will be adding bacteriostatic water to them using a reconstitution syringe. That will be imperative. You got to keep these to use for that. Now mind you, we're going to go through this whole process for you, but this is what you can expect to see. This is a 25 gauge needle. It will be used in conjunction with your testosterone draw needle so that you will draw up your testosterone and then you will switch that needle out. This is an insulin syringe. It's a much smaller gauge needle. It will be used for the delivery of either the HCG or the gonadoline because that's taken subcutaneously, not intramuscularly. And finally, you are looking at alcohol swabs or Prevantix swabs. Either way, these are used to sterilize both the top of the vials as well as the site of injection, whether that's the abdomen or the hip. And last but not least, this is just an alternate needle that you might see in your package depending on what's available from the pharmacy. But the important points are this. Larger needles are used to draw the oils, smaller needles are used to inject them, and the even smaller needles are fine to both draw and inject the water-based medicines. So what you see here is representative of what will be in the package and what you can expect to receive and the gist of why you're getting it. We're going to cover in further detail how to draw them up and how to inject them.